Hi, my name is Sonia Rowe Colzo, and I'll be doing my skills assessment with head to toe assessment and a subcutaneous injection. I know some of the video might be a little hard to see, so I'm going to try to walk you through as much of it as possible. I would be in my nursing uniform, but I left it in Philadelphia, so I'm sorry about that. We'll start with planning and getting equipment together for my head to toe assessment. I'll need my stethoscope, blood pressure cuff, pen light, pulse ox, and thermometer. And for medication administration, I'll need some gloves, I'll need my medication pad, my 2x2 gauze, a label, my alcohol swabs, my needle, and my medicine vial, and my NIR also. I'll start with prepping everything to go, and then we'll go to the patient's room and we'll do everything all together in the patient's room. So let's start with getting our medication ready to go. So first I would check the doctor's orders, make sure that the name of the patient matched the name on the orders. Also the drug matched the units or the dose matched the route, the time, and I would also make sure to see if they had any allergies. Then I would take my drug book and look up the drug, which is heparin. It says we're giving 5,000 units subcutaneous, so we would look and see if that was a safe dose. And it does say fixed low dose therapy for prevention of venous thrombosis, embolism, etc., which would be what we're doing in this case since our patient is in for a TIA or a mini stroke. So it says for adults, 5,000 units subcutaneously every 12 hours. So that's good and it checks out. The action of the drug, it is an anticoagulant, and it works by disrupting deactivating thrombin activity, and so it prevents new clots from forming, and it prevents clots that are already there from getting any larger. For adverse reactions, we're looking for hemorrhage, overly prolonged clotting time, thrombocytopenia, especially heparin-induced thrombocytopenia, anaphylaxis, hyperkalemia. And then for nursing considerations, we're going to check the vial very carefully since it comes in different concentrations. We're also going to make sure that we check the PTT carefully, monitor platelet count, and make a note that protamine sulfate is the antidote, and that would be administered 1 milligram per 100 units of heparin in case of an overdose. It's unsafe to withdraw abruptly from heparin therapy, which is why warfarin is usually given to patients to gradually take them off of that anticoagulant therapy. And then finally, for patient teaching, we're going to instruct the patient to watch for any signs of bleedings, especially bleeding in the gums, petechia, bruising in arms or legs, tarry stools, blood in the urine, anything like that. We're also going to tell them not to take any over-the-counter medicines such as aspirin or ibuprofen unless instructed to do so by a physician, as it could increase the anticoagulant effects of heparin. Also, the purpose why we're giving this drug is because our patient suffered a TIA, and we're going to prevent any new clots from forming and prevent any clots that are already there from getting any larger, which is why they're on heparin therapy. All right. So we check the patient allergies. The next thing that I would do is I would wash my hands. And I would get my medication administration record. I would select the correct medication, which would be the heparin, 5,000 units per ml. And then this would be, I also check the expiration date, and this would be my first check. Here I would also recite the 6 rights of medication administration, which would be right person, right dosage, right medication, right time, right route, and recording, or recording the data afterwards, documenting. From there, we're going to do our second check, which would be to compare the MAR against the vial that we selected. So it says heparin 5,000 units, and this says heparin 5,000 units per ml, so that is correct. This is our second check. From here, we're going to be doing our calculation. So I won't write it down, I'll just do it out loud. So it would be, we would always put what we want over what we have on hand. So we want the 5,000 units heparin, and over what we have on hand, we have 5,000 units of heparin, and then we would multiply that by 1 milliliter, and that would leave us with the volume that we should give, which would be 1 milliliter of the 5,000 units of heparin. All right, from here, we're going to prep our drugs. So we're going to take the alcohol swab. And we're going to wipe the top of the medication vial and let it dry. Then we're going to take our needle. In this case, we're doing a subcutaneous injection. So we have a needle that is 3/8 of an inch. You can also use a 5/8 of an inch needle for subcutaneous injections. Careful not to touch the plunger here. So we're going to uncap. Well, first we're going to draw in the amount of air that we need. So we're going to take in 1 milliliter of air into the syringe. From here, we're going to uncap it. And I'm going to stick it in my vial of medication and press the plunger down, putting the air into the vial. Here we're going to flip it upside down carefully. And then I will start to pull the medication into the vial slowly. If there are any air bubbles, you'd flick them to get them out. Looks like there is an air bubble. So we have the medication in the vial. We're going to recap using the capping method like that. We're going to label this medication. I have my label here. I'm going to write what it is and the dose. And we're only doing one patient at a time, so there should be no other patient name that you would need to put down on here. Okay, so this is our label. Ready to go. And then we're going to do our last check. So for our last check, we're going to check that vial against the MAR one last time, heparin 5,000 units, heparin 5,000 units, and the expiration date. And this will be our third and final check. Now we're ready to go to the patient's room. Patient. So I take all my equipment to the patient's room. I would first wash my hands upon arriving. I would introduce myself. Hi, I'm Sonia. I'm a nursing student. I would use 2 patient identifiers to identify him. May I have your name and date of birth, please?
James Colza, September 7, 1982.
And I would check his band. Do you have any allergies to any medications? Okay, great. I would raise the bed to a comfortable working height. I would assure privacy. I would put on a pair of gloves. And I would explain why I was there. Today we're going to be doing a head-to-toe assessment on you, followed by an injection of heparin. All right. Did you have any questions before we got started?
No.
Okay, great. Perfect. All right. So we're going to start with assessing level of consciousness. So I'd ask his level of consciousness and orientation. Could you state your name again, please?
James Colza.
Do you know where you are right now?
Columbus, Mississippi.
And do you know the date?
August, September, July 31st.
You're a very bad patient. All right, next we would do our vitals. So I have my handy dandy blood pressure cuff here. We would put the blood pressure cuff on, take the blood pressure, and we would do pulse ox. Can I have your finger, please? Pulse ox. Thank you. Take temperature. Temperature. All right. We would record all the findings, of course. And then could you please rate your pain on a scale of 0 to 10 for me?
0.
Thank you. Next we would do PERLA, pupils equal, round, reactive to light, and accommodation. So I have my pen light here. Can you look at my nose, please? Okay. All right. And then can you follow my finger with your eyes without moving your head? On my finger. All right, great, thank you. During the assessment, I would be looking at the condition of hair, skin, and nails of the patient. All right, now we're going to assess your upper extremities. Can you hold your arms out like this for me, please? All right, can you resist my hands pulling you down?
Yes.
Great. Can you grab my fingers and squeeze them? Okay, great. And then we're going to, can you feel my hands touching you?
Yes.
Okay, perfect. We're going to check cap refill. Okay, good, good. And then we'll check the bilateral radial pulses. All right, great. Next we're going to assess the heart. So I would find the PMI, or the apical pulse, which would be found by finding the 5th intercostal space, and then left midclavicular line. We're going to let my patient keep his shirt on, but that's where we would be looking. And then I would auscultate the pulse. I would listen for a full minute. so I counted 62 beats, which would be recorded. I also took an extra 30 seconds to watch the rise and fall of his chest, and I counted, for 30 seconds, I counted 7, so that would be multiplied by 2 for a full minute, so that would be 14 breaths per minute. And that we would start the lung assessment now. So I'm going to listen to your breath sound. So every time I put my stethoscope on your chest, if you could take a nice deep breath in and out for me, that would be great. Also, we would do this with the shirt off. Of course, we're going to leave it on for this. All right, now you're going to need to sit up a little bit for me, please. You scooch up. That's perfect. And we're going to listen to the lung sounds on posterior lung sounds. Nice deep breath in. Okay. Okay. And one more time. Okay, great. You can fly back down now. Thank you. Next, we're going to listen to bowel sounds, right, for our assessment. Okay. In all 4 quadrants. Okay, great. And then I would palpate the abdomen, checking for any tenderness or pain. You relax for me, and then just let me know if you feel any pain. I would also palpate the urinary bladder to check for any bladder distension. Feel any pain?
No.
Thank you. Perfect. Next, we would go down to the bilateral lower extremities. All right, can you bend your knees for me, please? All right. Can you resist my hands pulling it? Pull, yeah, good. All right, and now flex your feet up against my hands. And then flex your feet down like you're pressing down on the gas. Good. All right, we're gonna check for sensation. Can you feel my hands touching you?
Yes.
Okay, great. Temperature and color look good. Same thing with the upper extremities. We check for temperature, color, and sensation. All right, we're gonna check cap refill. Good, less than a minute. We're gonna check the posterior tibial pulses right behind the ankles. Good. And then we're going to check the dorsalis pedis pulses right on the top of the foot. All right, perfect. Okay, well that would consist of the head to toe assessment. At this time, I would check to see if there's an IV solution running. I would check the solution, the rate, and I would check the IV site on the patient, make sure there's no redness or irritation. I would check the oxygen, if the oxygen was running, check the settings on that, and then I would check any drains, after surgery, or any urinary catheter drains. Now we're going to do the medication administration. We're going to be giving you 5,000 units of heparin as per the doctor every 12 hours. We would need you to know, we would go over the information that I said at the beginning about bleeding, also about not taking any aspirin or ibuprofen. I would make sure the patient understood that. And then we would go ahead and administer the medication. For the site, obviously we're not going to be administering on the patient right now, but for the site, we would look between the anterior iliac spine in that region, and then 2 inches away from the umbilicus or belly button is where you would be injecting a subcutaneous injection of heparin. Also, you would make a note on the record, or you would look at the previous record to see where it was injected the last time, so you can alternate sites. Now I'm going to go ahead and show you how to inject the subcutaneous injection of heparin on my handy dandy injection pad. So I have my pad here, We have the needle. Also, just as a note, we did check the patient allergies, we checked the patient name and everything at the beginning of the assessment, just, you know, in case we could check that again just to make sure, you know, that it was the correct patient getting the correct medication. All right, so we're gonna take the medication and take our alcohol swab in the injection site that I had said we make sure that we have gloves on. We would take the alcohol swab and then wiping from the inside to the outside with the alcohol. We'd clean the site, dispose of the alcohol swab, and then take the needle. Be careful not to touch the plunger. We would uncap the needle. We would pinch the area. We would inject 90 to 45 degrees like you're throwing a dart. And then we would inject the medication. You might tell the patient he might feel a burning. Inject the medication. We would grab the gauze as you take the needle out, put the gauze over the site. You would immediately use the safety device to cap the needle and put it in a sharps container. You would hold the gauze for a few more seconds. And then that would be that. You would document immediately on your medication administration record and on the patient's chart the dosage and where it was given. At this time, I would raise or lower the bed. I would raise any bed rails that the patient might have. I would make sure the call bell is in reach. Make sure that they have anything that they need. Assure privacy. And then I would take off my gloves and then wash my hands. And that would be the end of the assessment. Thanks so much for watching, and hope to see you guys soon in Philadelphia. Thanks.